The Pan American Health Organization has issued an alert to all regional health providers, advising of a growing dengue outbreak in the Caribbean, here at home. The Public Health Department recently shared that it was awaiting test results for 6 potential cases of the mosquito-borne disease. Tonight, I'm joined by Public Health Surveillance Officer Timothy McLaughlin to discuss their efforts to keep Cayman dengue-free. Mr. McLaughlin-Munroe, actually. Welcome.
Thank you.
So, is there a cause for alert right now?
Yes, because there is an increase of cases in our region, which includes the Americas, not just the Caribbean islands, but Central America and South America as well. So, yeah, there is an increase in numbers, but it's not quite yet an outbreak. It could lead to a potential outbreak of the disease.
What would it take for it to be an outbreak?
Well, to go over the threshold, normal threshold, and right now we're seeing that, but they can't officially call it an outbreak until all the cases are calculated. What we're seeing is more severe cases with the number of cases that we're seeing so far this year throughout the region. Thankfully for us here in Cayman, we haven't had any dengue imported so far, and it would have to be imported first in order for us to get a case of dengue.
So what are the initiatives that are being put in place to help protect us and our citizens?
Well, we have ongoing systematic eradication of the vector, which is the Aedes aegypti mosquito, which also carries about 4 other diseases. So it's an ongoing thing with the MRCU, and we're the only Caribbean country that actually have a dedicated unit just for mosquitoes. So they've been doing an excellent job. We have the plane, the fogging. They do a number of different interventions, even in the dry season as well as the wet season. So when we have a case, a suspected case, we report to them automatically where that person lives and work, so that they can enhance the eradication of that mosquito in and around that person. So just in case it comes back that it was positive, they know that they would have possibly killed all the adult mosquitoes that would have bitten that person to continue the transmission. And if it comes back negative, it's all great too, because it just killed some more mosquitoes.
That's right.
So,
well, what are some of the symptoms that one would experience if they were infected?
Okay, good question. With dengue, it's a virus, so like with most of your viruses, you'd have high fever, very high fever with dengue. One of its nicknames is breakbone fever, or breakbone. So you'd have that, headaches, eye pain behind the eye, we call it retroorbital eye pain, chills, severe fever, and also a rash. Dengue is known. I mean, sometimes you might not have the fever, some people have it mildly, but they'll get that rash, and that's one of the telltale signs of dengue. There are other symptoms, and it can also be more severe, where a person actually have what is called dengue hemorrhagia, where they actually bleed. Their platelet counts go down. Where
would they bleed from, may I ask?
Just internally. You can also bleed external, but it's mostly internal bleeding. So you have what is called a hemorrhagic shock syndrome, and that's the more severe case, and that's what the region has been seeing. I think it's like somewhere in the region of 3,535 cases of severe dengue throughout the whole region, which works out to less than 1% of the total number of cases.
Well, let's hope that does not happen here, and that everyone is aware of those symptoms so that they can get checked right away. Well, thanks for joining us this evening, Mr. McLaughlin, and we'll keep a watch out on that.
Thank you.
All right.